Welcome back to News and Views right here on Salam Media, your home of humanitarian journalism. The time is 6 minutes before the top of the hour, and this hour of News and Views is sponsored by African Muslims Agency. African Muslims Agency, a beacon of hope to communities for over 35 years in Africa and beyond. In a bit, we'll be addressing a critical public health crisis that has shaken communities across South Africa, particularly in the rural areas and the townships. The recent incidents of a food poisoning affecting mainly school children, most tragically resulting in the deaths of 6 young lives in Soweto this past week. This has prompted urgent investigations by the National Department of Health. In response to this alarming situation, the department has deployed environmental inspectors to identify, a potential chemical agent that could be responsible and to ensure food safety in our communities. And to help us shed light on this investigation and the broader implications for food safety regulations, I'll be joined by Foster Mohale, he's a spokesperson at the National Department of Health. Foster, thank you so much for joining us. Welcome to Salam Media. Really appreciate you giving us your time.
Good morning to you and good morning to your listeners and viewers, and thanks for this opportunity.
I think first and foremost, if you can start by providing us a short overview from the Department of Health's point of view of the current situation regarding the food poisoning incidences in South Africa, particularly in the townships, and what specific actions has the National Department of Health taken in response to some of these tragic events?
Yeah, as you correctly pointed out, that currently the country is experiencing sporadic cases of food poisoning. So far, about 4 provinces: province of Gauteng, province of Limpopo, province of Mpumalanga, and province of Free State. Even though now there are unconfirmed reports about similar cases in the province of KZN, but we are yet to receive a formal report. Secondly, let me, on behalf of the department, let me express my deepest condolences to the families who have lost their loved ones, those 6 children who died in Gauteng, Soweto, Naledi in particular, after allegedly consuming the snacks. Yes, as the Department of Health, working together with other public entities on behalf of government, we have established a multidisciplinary team following the instruction from a cabinet, where the Minister of Health has been directed as the lead minister in response to this ongoing cases of food poisoning around the country. We have established this multidisciplinary task team, which consists of experts and individuals, including the Department of Health, especially the health practitioners, the Department of Agriculture, which is responsible for controlling the use and the distribution of any chemicals in the country, the Department of Police, SAPS, which is responsible for investigations, especially where there is a case of where there's a loss of life. We talk of the National Consumer Commission, the municipalities, and other range of public entities, where we establish a task team to respond, to investigate the possible cause of these deaths and cases of food poisoning, because of course there are a number of leads that we are following, but we don't want to rush jump into conclusion to say these kids, they died because they consume this or that. So only the investigations, especially laboratory test results of the samples and the swabs, including the autopsy for especially from those kids who have passed away, the results will be able to tell what could be the cause of death of these 6 children.
Um, the deployment of these 80 environmental inspectors is a significant step. If you can just maybe elaborate on what their roles will be during this investigation, and what areas will they be focusing on across South Africa? Are they key targeted areas where you think this investigation needs a more focused attention to?
Yeah, no, this team, the team that has been assembled here is only focusing in Gauteng, but we have communicated with the provinces and the districts to establish the similar teams in the provinces and in the districts in order to intensify health inspections in this not only in the spaza shops but also in the retailers, in the warehouse, in the places where they process the food, where they package the food, where they repackage the food. As you know that the entire food value chain starts from the production, from processing, from transportation to storage to packaging and repackaging. So we said we want to check in all these stages of food value chain to check if where could the ball been having been dropped, because the contamination can take place in any of these stages, whether they where they produce, where they process the foods, especially learning from the lessons of responding and managing the previous similar outbreak of listeriosis in the country, which was traced back to a plant in Limpopo, which is responsible for Tiger Brands a plant where they are processing things like your polony, your cheese. So learning from those experiences, we believe that even this time we can be able to make a breakthrough. But what you don't want to do is to jump into conclusion to say the kids they died because they ate this or that. But only the investigation will be able to tell us. But in terms of the number of inspectors, look, that team, as I indicated, that is a multidisciplinary team. The inspectors of the Department of Health, working with the municipalities and the Department of Health in the province, they are looking at the compliance from health point of view, while the police, they check whether there are any illegal items or chemicals that are so that are used by these retailers. Then the Department of Home Affairs, which is also part of the team, is also checking whether those who are operating these shops, tech shops, retailers, are they in this country legally? If they are in the country illegally, then they get deported. Then the police will arrest anyone who is found in possession of illegal chemical or substances. So different teams will look at the different mandates to check whether all those who are managing these retailers or spaza shops, they are in compliance with all different regulations and the laws as specified in their license to operate these shops.
Mm-hmm. According to one environmental health practitioner, Laki Tsihanyisi, well, he
Mhm.
came out to the media. He says there's no toxic chemicals which were found in some of the snacks that are believed to have caused the deaths of the six children in Naledi. Number one, was this part of the Department of Health's, part of investigations? Because it kind of contradicts what Minister Aaron Motsoaledi came out to say. The health minister Aaron already mentioned that
Mm.
the investigation that you guys have done have concluded that a chemical agent is responsible for the illnesses. So if you can just unpack and clear out those two contradicting notions, which one is which, and do they all make up part of the Department of Health's investigations?
Yeah, no, we've seen that a clip by Mr. Laki Shanyise, who is currently is part of a government multidisciplinary task team. So by the time he responds, he's working for the city of Johannesburg. By the time he made that response, it was a preliminary response on the preliminary investigations conducted by city of Johannesburg. But since the national government has taken over the process, so for now we say we are broadening the scope. So what, like he was saying, it was based on the preliminary investigations they've conducted, which was only focused on one spaza shop. So now we are trying to broaden the investigations, but also on that sponsorship, because we are trying to bring more other methods of investigations. The same spaza shop which the city of Johannesburg has conducted their preliminary investigations. That's why we even brought the National Institute for Communicable Diseases, which is an expert in this field of testing and investigation. So what like you were saying, yes, it was based on their preliminary investigations, but now the national government is taking over since I've mentioned a number of stakeholders which are now part of this multidisciplinary task team. So the actual results will be released in due course as soon as we get all the necessary test results conducted by different stakeholders, the National Institute for Laboratory, the National Institute, NICD, the Department, the Police, the Department of Agriculture, the Department of Health, the National Consumer Commission. So we are going to get a comprehensive report which will be able to give the public an idea in terms of how far the investigations process have been going. But we can assure the public that there's no need for public to be to panic. They need to give us enough space to ensure that we leave no stone unturned, and we don't want to rush these investigations because we will end up making mistakes. So we don't want to make mistakes and jumping to conclusion to say the cause of death was this. Hence, I gave you example of the investigations into the outbreak of listeriosis, where we took time until we experienced we discovered that the source of contamination happened in Limpopo, but the majority of the victims were found in province of Gauteng, which was difficult for many people to understand that the source of contamination is taking place in one province, but most of the victims are found in another province. So even in this case, we say South Africans, the public, give us enough time in order to do the thorough work. We don't want to make mistakes because we want to give them a very authentic and reliable investigations outcomes based on the good work that we are doing.
Mm, mm, mm. Speaking of good work, if there's one thing that the National Department of Health can be lauded on is public awareness. I think you've run some very very successful campaigns. When it comes to issues like HIV and AIDS. I think during the COVID times, you were heads and shoulders above a lot of institutions when it comes to raising awareness and letting the public know and
Mhm.
understand what needs to be done and how they can go about safely navigating some of these pressing issues. When it comes to food safety, especially among parents and caregivers of school children, has the Department of Health taken enough steps to raise awareness about food safety and how people can go about recognizing what's safe to consume and what's not safe to consume, and just broader public awareness campaigns? And is anything of that kind in the pipeline? Because you asked for time. Well, while you're asking for time, you have kids in puzzle shops still buying the very same things that might or might not have not killed those kids that have passed away.
Yeah, no, no, I really get your point. Unfortunately, the work of inspection involves many stakeholders, not only the National Department of Health, because as National Department of Health, we are responsible for legislative guidelines to develop the laws and the regulations, which are implemented at the municipal level by the health environmental practitioners, which are called health inspectors. So the actual inspection is conducted by the health inspectors who are located at the municipalities. But also there are other role players, as I've already indicated, that we also have the Department of Agriculture, which is responsible for ensuring that no one is supposed to be in the possession of illegal chemical substances which are not supposed to be distributed in the country. The police also, they are ensuring that anyone who's found in possession of those illegal substances, they are supposed to be dealt accordingly. Of course, the issue of inspection is of course, the Department of Health is leading, but it's supposed to be a societal concern. If you go to your nearest spaza shop, you found that things are not being done or conducted according to the protocols. They sell expired food. I'm just giving an example, even though for now we cannot say the kids who have died is because of contaminated food from the spaza shop. It could be only the investigation will be able to tell. But with regards to reporting any non-compliance by any retailer, whether it's a big retailer, big brands, or sponsor shops, we want to call upon members of the community to say, please don't keep quiet. If you go to the shop, they sell expired food on a very affordable and cheap price. Don't smile and say we are affording this. You need to break silence. You need to report such, because such is a risk on its own that can put the lives and the health of your fellow community members at risk. So you need to work with the Department of Health. We need to work with the police. We need to work with the municipalities. We need to work with the traditional leaders. We need to work with other stakeholders within the community in order to report and root out any non-compliance which might be a health risk on the communities.
And just lastly, before I let you go, looking ahead, what are some of the long-term strategies that the Department of Health could be or should be implementing to ensure food safety in schools and communities across South Africa? And how can families better safeguard against foodborne illnesses? I think you mentioned that reporting, non-compliance of these puzzle shop is the first step, but is there any other steps that parents, families, caregivers can take in better safeguarding against foodborne illnesses?
No, no, definitely. Remember that we also preach gospel to say we need to ensure proper food handling at the household level, also at the manufacturing and processing or warehouse level. We need to ensure that we handle the food according to the proper food handling protocols, where they say don't mix the food, the cooked food, with not with the raw food. Please don't do the same. Where they say, especially for those who are cooking food for mass catering, especially during summer, we say don't cook. If you know that you are going to serve the food for mass catering the following day, don't cook the food to a day before with the hope of saving the food the following day, because that food contamination, some of the preservatives, some of the things that we add in the food may react. So hence we say, please try to comply with proper food handling. That's number one. Number two, we say let's try to maintain hand hygiene at all times. Let's wash our hands with water and soap. Let's wash our utensils with water, especially the hot water and soap, in order to kill any bacteria that may lead to food poisoning, in order to save the lives of our people.
All right, I think we're going to leave it there, Foster. Thank you so much for giving us your time and just unpacking this very, very pressing and concerning issue that the most vulnerable in our communities are currently grappling with. Great. That was a spokesperson at the National Department of Health, Foster Mohale. I think as we reflect on the tragic deaths of these six children in Naledi, and I think in other parts, because I think Naledi is not an isolated case, it's clear that this devastating incident should have ignited a profound sense of anger, and not just anger, but also urgency, because I feel like we're not angry enough. There's no anger and urgency within our communities and across the nation that these young lives have been lost due to suspected negligence in food safety, and this should serve as a wake-up call for all South Africans. The alarming revelation that no toxic chemicals were found in the snacks doesn't absolve us from our responsibility to demand better oversight. I think that's what's lacking: better oversight and stricter compliance with health and safety regulations, especially in vulnerable communities like Soweto. I mean, I read somewhere that there's only 33 environmental health practitioners, which are overseeing a population of over 1.5 million people in Soweto. We are failing to meet even the most basic global health standards, and that should be concerning. It is not enough to, mourn the loss of these children. We must channel our grief into action. We need to hold our government accountable for the inadequacies in health inspections and the insufficient support for our communities. Because imagine if this happened, let's say Northcliffe. Do you think the response would have been the same? Or it's because, well, it's an news all the time. The safety of children in South Africa should never be compromised. That's one thing I think we can wrap up the citizens who must raise our voices and demand that our government prioritize public health and safety. We need to. We can't have people just continue with impunity. We know it's a known fact. Our government knows. Our various leaders, they know that some of these puzzle shops, they sell expired food. That's what they do. Eh? But there's nothing being done about it. And now we're trying to scramble. Well, let's get 80 inspectors. Let's do this. Let's do that. You want to do that now when parents have lost their children? Now. Really disappointing. We've come to the end of News and Views. Well, today's edition of News and Views with myself, Salailo Makudira. I'll be back with you again tomorrow morning for the Thursday edition of the show. But for myself, Salailo Makudira, and the rest of the team, it's goodbye. We'll see you again tomorrow.
We are here in the middle of a Zahra neighborhood. The whole neighborhood is already destroyed. More than 17 towers are down. Here, as you can see, the firefighters trying their best to help. The people are still under the rubble. A lot of the people.
Join Hamza on his exclusive South African tour as he shares his personal experiences, never before seen footage, and powerful insights on the ongoing genocide in Gaza. This is more than just a talk. It's an invitation to witness Gaza through the lens of Hamza Sha'alan. Don't miss this opportunity to meet the photojournalist who brought Gaza's pain and perseverance to the world in its darkest moments. Follow Salam Media on social media pages for more on this tour and be part of the conversation.